Hi, my name is Noel Chapman from Central Queensland University. Welcome to my literature review on the effects of aerobic versus non-aerobic exercise in the prevention and treatment of dementia. It is estimated that in 2010, 232 Australians were affected with a case of dementia, either mild, moderate or severe. However, without an intervention, it is estimated to increase to 744,000 by 2040. With an intervention, it is said to increase to 609,000 by 2040. This is 135,000 less cases in Australia. The type of care provided in Australia to persons with dementia is primarily dependent on the severity of the disease, mild, moderate, or severe. Between cost and prevalence is dynamic and mediated by the interaction between dementia severity and formal-informal costs. In 2010, it was estimated that dementia care would cost $8 billion and without an intervention would increase to $29 billion by 2040. However, with the introduction of intervention, it was estimated to increase to $25 billion. This is $4 billion less than without an intervention. Google Scholar, PubMed, Science Direct, and EBSCOhost were used to search terms such as dementia, exercise, aerobic exercise, resistance exercise, cognition, and physical activity. This literature review included studies no older than 10 years, so prior to 2005. The participants were no younger than 50 years old. Aerobic or non-aerobic studies were included, and the participants all had cognitive impairment. 10 studies were used in this review. 6 were aerobic in nature, 3 were non-aerobic in nature, and 1 looked at aerobic versus non-aerobic exercise. The 6 aerobic studies all looked at different study designs. The trial varied from 12 to 26 weeks, training 3 to 4 times per day with a duration of 30 to 60 minutes per session. However, all studies demonstrated an improvement in cognitive function. Non-aerobic exercise. The 3 non-aerobic exercise studies all showed an improvement in cognitive measures, although the study designs also varied for these studies. The trials varied from 4 to 24 weeks, training 2 to 5 times per week with a duration of 45 to 60 minutes per week. One study was found where aerobic and non-aerobic were compared to determine the best exercise to prevent or treat dementia. It was found that there was more cognitive improvement for aerobic exercise than anaerobic exercise. A study by Fredrickson looked at the effects of aerobic exercise on cognition and found that there was no significant difference between moderate and high-intensity exercise and showed equally beneficial effects on cognitive function. This was also found in Casey's study, who looked at resistance exercise and cognition. The study established that moderate and high-intensity resistance exercise showed equally beneficial effects on cognition. A study conducted by Varela looked at aerobic exercise and showed improved effects on cognition. However, it was not significant. This may indicate that a 12-week trial is not a long enough period to see a significant improvement through aerobic exercise. However, for a non-aerobic intervention of 4 weeks by Anderson-Hanley and 10 weeks by Urankin, the studies looked at resistance exercise and showed significant improvement in cognitive function, indicating that non-aerobic exercise improves cognition faster. However, this is just an assumption and cannot be concluded without further research. Furthermore, a study by Oskaya compared both aerobic and resistance training to establish the effect of different types of exercise training on cognitive performance. This study found that strength training may aid in early information processing and cognitive function than aerobic exercise. Oskaya noted that the mechanism of the event-related potential changes induced by the strength training is not yet known. However, it was found that after strength training, neurobiological changes such as changes in cerebral blood flow, neurotransmitter functioning, or increased cell complexity might occur in different brain regions and contribute to central nervous integrity. Further research needs to be undertaken to fully understand the central nervous system and their associated components of the event-related potentials. It is evident that further research needs to be conducted on aerobic versus non-aerobic exercise, which may lead to a multi-component exercise program consisting of aerobic and resistance training. It is concluded that both aerobic and non-aerobic exercises both facilitate cognitive improvement of dementia. However, more research is needed to understand if non-aerobic or aerobic exercise better facilitates cognitive improvement.